Introducing DERMABOND Mini Topical Skin Adhesive. DERMABOND Mini provides a protective barrier that adds strength and inhibits bacteria. To use DERMABOND Mini, begin by following standard surgical practice for wound preparation. Before applying DERMABOND Mini, make sure that the wound and the skin around the wound are clean, dry, and free from infection. Pat the wound dry to assure direct contact of the DERMABOND Mini to the skin. Work with the wound as nearly horizontal as possible to prevent any inadvertent liquid flow. To apply DERMABOND Mini, start by holding the applicator away from the patient with the tip pointing upward. Squeeze the bulb to crush the ampule inside, and then release pressure. After squeezing the bulb, turn the vial tip down and gently squeeze the bulb again to moisten the internal filter with adhesive. DERMABOND Mini should be used immediately after crushing the glass ampule, as the liquid will flow freely from the tip for only a few minutes. Do not crush the contents of the applicator tube repeatedly, as further manipulation of the applicator may cause glass shard penetration of the outer tube. Glass shard penetration can result in inadvertent skin punctures, which may result in the transmission of bloodborne pathogens. Approximate the wound edges with gloved fingers or forceps. Apply the product to the approximated wound edges using a gentle brushing motion and maintaining steady bulb pressure. Excessive application may cause the patient to experience a sensation of heat or discomfort. This can be minimized by applying DERMABOND Mini in 2 thin layers. Hold the skin edges and wait for approximately 30 seconds before application of a second coat. Next, apply a second coat. Maintain manual approximation of the wound edges for 60 seconds after the final layer. Do not pump the bulb as it may introduce excess air bubbles into the adhesive. Full polymerization occurs in about 3 minutes. After polymerization, your wound closure is complete. Do not apply liquid or ointment medications over DERMABOND Mini. These can weaken the film and its bond to the skin. After the film is fully polymerized, a dry dressing may optionally be applied. Patients should be instructed on proper care of a wound closed with DERMABOND Mini.